Hi everyone, I'm Yo and this is Vaginia. Welcome to our YouTube channel, Knowing, Caring, and Loving Your Lady Parts. So this video is part 2 of Knowing Your Lady Parts, the female anatomy, what's normal and what's not. So let's get started. Everyone, and if you're new, please don't forget to hit that subscribe button and share with your friends. So remember in the first video of knowing your lady parts and meeting your vulva, we got acquainted with your vulva, which is, remember, the outside or the door or the external female genitalia area. Now that you've been acquainted with your vulva, you know what your normal is, but what is normal? What should I be looking at in this area when I'm exploring and examining it with a mirror or even just touching it? Remember that it is normal to have different shapes and sizes of the labia. So you've got that outer, remember, labia and the inner labia, the labia majora and minora, and that is normal. And it's normal to have different colors of your skin. It's not just that pinky color that you see, in pictures, but you can have a darker brown, reddish color. So what is not normal then? Well, when you're exploring around your skin and labia, if you have any increased sensitivity when you're feeling around the vulva region or the skin feels thin or super sensitive, then there may be something else going on around here. You may have a skin condition called lichen sclerosus or something else going on. Sometimes you might hear this term called Vulvodynia, which is basically sensitivity or pain in the vulva region outside, where women can complain of when they wear tight jeans or the seam is digging in this area, it can be sensitive. As I mentioned before in the first video of female anatomy, Vaginia has a bit of a skin condition here. So her inner labia is almost blended in with her outer labia. She has a bit of lichen sclerosus, but it's well under control, so you don't have to worry. The other thing to look for with respect to skin conditions is check out remember that clitoral hood, which protects that magical area that Vaginia's wearing a nice little yellow shiny thing today. Just make sure it moves. So it should not be bound down. It should have mobility. Hers is a little scarred down because she has a little bit of that skin condition, but as you move, you should basically be able to lift that hood up and say hello to the clitoris, and it shouldn't be stuck down there because that could be also indicative of something starting with respect to a skin condition. But again, check it out, and if you're not sure, ask your family doctor. And remember when we discussed the anatomy in terms of the opening of the vagina, there's glands there called vestibular glands. So if you feel around here, you should feel that it's not excessively sensitive. And in particular, if you have pain during opening at the entrance, you may have some sensitivity of those vestibular glands. So you want to have a feel around in terms of the opening of the vagina at the bottom to see if those glands are sensitive. If they're overly sensitive, you may have a condition called vestibulodynia, or another painful condition. Again, it's good to see your doctor if you feel that there is an increased amount of sensitivity or pain in this area. Unfortunately, as we reach those hormonal stages in our lovely lives as incredible women, and this can happen, yes, before you have a baby also, and after a baby, because hormonal changes occur after you have a baby, especially if you're breastfeeding, these areas can be sensitive. And also, unfortunately, during those fun decades that I might be going through, which are perimenopausal or menopausal, where your skin starts to thin like everywhere else in your body. It's fun stuff, let me tell you. Well, you can get skin conditions also. So just be aware of that when you're examining and exploring in that area for sensitivity. So what you can do is take a mirror and have a look to see if anything is descending down when you're standing. So if you're standing with the mirror, just cough or bear down so it increases the pressure, and just open up your labia and see if you see a bulge or anything that is either in the front or back in that area, in the vaginal opening area, because it may be a prolapse and that's not normal. And I see that a lot, unfortunately, with a lot of new moms. And it's important to know if you have something like that, because then you can be preventative and make sure you're releasing pressure and guarding that area, which I'll talk about, of course, in another video. Sorry to cut up my face, everybody, but what you want to do is take a mirror, open up, right? And this is my mirror that I have, right? And just bear down. So you're bearing down and coughing to increase the pressure here. So it'll push pressure on those pelvic organs, and have a look to see if anything is bulging. With respect to a prolapse, now I don't know if you can see, and I'll bring it close here. So I just put a bead there because sometimes what you might see is you might see something and it actually kind of looks like this. It's kind of jagged. And that can be the opening of the bladder, the urethra, if you can see that. That's hanging low. It probably is a little bit bigger than that. And then if your bladder is hanging low, then that actually kind of looks like a balloon sometimes hanging out, because it's part of the front of the vaginal wall. And then if you see something at the back, that can be part of the rectum, unfortunately. So again, examine to see if anything seems to be low when you increase the pressure by bearing down or coughing in the opening, because even a small descent is not normal, and you want to prevent things from hanging out, which is a huge problem when that happens. Prevention is the key, and there are a lot of exercises and tips that a pelvic floor physio can provide. Last but not least, in the pelvic floor region, or the lady part region, is have a look in terms of your pelvic floor muscles. So we're going to use Myrtle, the girdle, woo, today again. And we're going to take out her, remember this is the vulva, the outside. And here are the pelvic floor muscles, which we talked about in the first video. And I'm going to go in more detail in my pelvic floor video. You want to have a feel to see, if you can put your fingers inside and how tight it is. If you're having problems putting a tampon in, and of course, if you have pain during intercourse, or you can't put your fingers in and there's pain, then there may be some tightness in the area that you want to get addressed, because that's not normal, especially any kind of pain during intercourse. When you're examining, and I'll turn her over here, what you're doing is, if you'll have to put your thumb in, but I'll use my fingers because I have a better angle, and this is what a pelvic floor physio does. You want to feel the muscles on the inside and feel if you can contract, relax, and is there any pain when you're feeling those pelvic floor or lady part muscles. Again, at your angle, you may have to come in with your thumb because you're at a different angle. So it's not as convenient and easy for you, and a pelvic floor physio will be able to assess this very, very accurately. In summary then, check your skin in your vulva region to make sure that everything feels normal, it's not hypersensitive. Check your clitoral cutout to make sure that it's mobile. You shouldn't have any pain in this area. Secondly, check out and examine the vestibular region, those glands in the opening at the bottom of the vagina, to see if they're hypersensitive or if they feel normal. And then look to see in the vagina by coughing or increasing the pressure to see if there's any kind of signs of something that is lower than it should be, which is indicative of possibly a pelvic organ prolapse when things hang down lower. And then fourthly, have a check on the inside of the pelvic floor muscles with using girdle here, and check to see if these are tight, and just assess the tone to see if there is any tightness or pain, which is not normal. Thank you everybody for tuning in to this second video of Knowing Your Female Anatomy Part 2, what is normal and what is not in the lady part region. And please don't forget to subscribe and tell your friends. Also, don't forget to write a comment in the section below. And please tune into our other videos to learn more about these lady parts. We look forward to seeing you soon.